So good evening, everyone. So today we are going to discuss a very interesting topic, the master tongue acupuncture for liver disease. So let's start. So we can see in this image, in the liver, we are having two lobes, the right lobe of the liver and left lobe of the liver. So liver mainly placed in the right side, below the ribs, and just here only, we are having one structure that is called gallbladder. The gallbladder is the structure we can see in this image who collect the bile juice. So this is the right lobe and left lobe. So liver is made by two lobes. If we see the body, if we see the body, physical body, in the physical body, liver is situated in the right side. Suppose this is a physical body. This is the physical body. In the physical body, the location of liver is on the right side. But energetically, if we talk about as per the nature, liver are affecting left side of the body more efficiently. The liver is situated on the right side, but liver is affecting the left side of the body more efficiently. So shortly we will see the master tongue has been given the points on the right side and also on the left side. But the left side point are more effective when we are talking about the liver treatment. So if we do the treatment on the left side, it will work 70-80% or more than that. So the liver point are more effective in the left side. That's why Master Tung told all the time, if you want to treat the liver, treat on the left side. So let's talk about the disease which is very commonly happening. The very common disease, the name of this disease is hepatitis. The meaning of hepato means liver and itis means inflammation. So this may be because of the virus. And if someone is drinking a lot or many drugs, hepatitis A, hepatitis B, C, in this way, these are many hepatitis. The more common disease is liver cirrhosis, cirrhosis of liver. In the cirrhosis of liver, the liver cells are damaging and scar formation is there. So if we are having this much liver, so some part of the liver is getting scarred and that part is not working. When cirrhosis of liver remain in the body for longer time, sometime it convert in the liver cancer. And liver cancer, one of the most common cancer found. If someone is suffering with the liver cirrhosis or liver cancer, sometime what happened? Liver cells is leaking out and the liquid is depositing or accumulating in the belly. So this is called accumulation of the liquid, ascites. Ascites is also very common problem. I have treated the patients was suffering with the liver cirrhosis and ascites because liver cells is getting perforation, leaking out. So the liquid is coming out and collecting in the belly. So belly become distended. And many times, if gallbladder stone is stuck in the pipe, bile duct, that also create the hepatitis. So there may be many causes. In this way, there are very common disease, hepatitis, cirrhosis of liver, and liver cancer. Right now, a big population are suffering with these problems. And the more common problem is fatty liver. Fatty liver, one of the very common disease. Even doctors are ignoring it. Doctors are telling you, okay, let go it. Do not worry for this. But when someone is suffering with a fatty liver, if he take care of the liver, that time only, so maybe he can not proceed for the liver cirrhosis, for the liver cancer, for the ascites. But during the fatty liver, all are ignoring the liver. Coming to the acupuncture. In the acupuncture, what is liver? As per the acupuncture, liver is not a ordinary organ. As per the acupuncture, liver is the place where our corporeal soul, liver is the place where our hun, or etheric soul resides. What is etheric soul? We know that we are live human. Because of soul inside, if we see the dead body, in the dead body there is no soul. As per the acupuncture, these all things are energies. So the live body having energy in the form of etheric soul, and the dead body not having any energy. So liver has been considered as a residence of Hun. The meaning of Hun is etheric soul. Like, just remember, when we were in the mother womb, we were taking all the nutrition from the umbilical cord. We were taking all the blood from the mother, from the umbilical cord. Our lungs were not working that time. So we were getting the blood from the umbilical cord and it was going to the liver. And liver was doing lots of metabolism, filtration. So liver is active since we are in the mother womb. And lungs are active after the birth. So etheric soul is the soul. Who is responsible for yang energy in our body? Let's discuss this thing here. So what I told you, the liver is the residence of Hun or etheric soul. The etheric soul, the nature of etheric soul is very young, very dynamic, very aggressive. So etheric soul good, then we will be very energetic, very enthusiastic. We will be very aggressive. We will be dynamic. And if etheric soul is poor, weaker, and not having the proper place to reside inside the liver, then the person will having no aggression. Suppose you are playing a football, but you are not having any aggression, then you cannot play well. So liver has been considered the place of anger, aggression, place of energy. So that's why when someone expressing the anger in the playground, it is very good. But when person expressing the anger in the family, in the home, with their own colleagues, then damaging, this anger damaging all the things. If some person angry again and again, so this is the starting stage of fatty liver. So this is the starting stage of fatty liver. If some person angry again and again, so be careful, means starting of liver problem. And many times this liver problem convert in the fatty liver. What is fatty liver? In the liver cells, there are deposition of the fat cells, and these fat cells making the layer, and that part is covered by the fat and not working properly, not doing metabolism properly. So as liver become more fatty, more fatty, more fatty, so fatty liver grade 1, fatty liver grade 2, the particular part of the liver is becoming more and more, the area of fatty liver is becoming more and more, and person is unable to metabolize all the product. So as per the acupuncture, if we want to treat the fatty liver, if we want to treat the anger, aggression, we have to focus on the liver. So we have to balance the etheric soul or hun. So this has been considered in the acupuncture. The liver reside in the left side of the body, in the right side of the body. And the liver meridian, we have learned the liver meridian. When we see the internal pathway of the liver meridian, internal circulation of the liver meridian, the internal circulation of the liver meridian crossing the eyes and reaching on the top of the head. So if you want to treat the vision problem, eyes problem, if you want to treat the blood vision, if you want to treat the glaucoma or high pressure in the eyes, if you want to treat the numbers of eyes, like unable to see near object or far object, if you want to treat the tiredness of the eyes, so we are working on the liver only, because internal branch of the liver passing through the eyes, supplying to the eyes. That's why if your eyes are without blood, or we can tell the pale eyes, it is the diagnosis of liver having lesser blood. In the acupuncture, we are telling liver blood deficiency. On the other hand, if your eyes are red, then we are telling this is the condition of liver heat. So whatever happened with the liver, the same things happen with the eyes. So eyes has been considered the mirror of liver. So just taking the water in the mouth and splashing the water on the eyes 20-25 times is also very good treatment of the liver. It will calm down your liver. It will calm down your brain. just splashing the water over the eyes because liver channel passing through the eyes. And eyes are the sense organ of liver. In my village, I have seen one person who is treating the liver patient with one very good treatment. He is taking some Ayurveda herbs and putting on the DU 20 points, putting on the Sahasrara chakra, putting on the top of the head. So for the ordinary person, it's very difficult to understand what is the connection of jaundice, what is the connection of liver problem with the top of the head. But the person who is treating, who is doing this treatment, he just taking the herbs and putting on the top of the head. Only 1 minute treatment and telling the patient, okay, go back and come after 15 days. So the DU 20 point is directly connected with the liver. In the Ayurveda, there are many drugs. They are very cooling, like Punarnava, like Bhumi Amlaki, Punarnava, Bhumi Amlaki. They are the very famous drugs in the Ayurveda, like Punarnava and Bhumi Amla. Just crush the leaves, fresh leaves, put some liquid and just put on the Sahasrara chakra DU 20. The if we see the liver channel, liver internal branch reaching to the DU 20, like suppose you are not having anything, you are not having anything, any herbs, then what to do? In that condition, if you find the liver is not working properly, you can put, if liver is having more heat, you can put some cooling oil on the top of the head. So it will cool down the liver. On the other hand, if liver is having poor energy, poor blood, lack of circulation, in that condition, we can increase the energy by putting some drugs having hot nature, like Rashnadi Churna, Rashnadi powder. In the Ayurveda also, we put the Rashnadi powder on the top of the head. In Ayurveda, we are telling this is Vatanashak. This is Vatanashak, means preventing the attack of Vata, preventing the attack of joint pain. So see the very beauty of the DU 20 points. Because as per the acupuncture, liver or Bud element, Bud means movement. So I can do the movement of the elbow, I can do the movement of the neck, I can do the movement of the multiple joints if my Bud element is good. So liver means Bud means movement. So if someone is feeling the joint pain while doing the movement, we can do the application of Rashnadi powder, Rashnadi Churna, Rashnadi powder on the top of the head. So in this way, we can treat the liver from the top of the head. We can treat the liver from the eyes. So wherever liver channel is going, we can treat the liver. The Sahasrara chakra is the most effective point. Even if someone feel that his liver is having more heat, and because of the liver heat, he is having some eyes problem and anger, aggression, he just can put castor oil on the top of the head. So castor oil will calm down the liver. So in this way, this is the some basic things about the liver. So right now what I want to tell you, liver is the residence of etheric soul. So our soul resides in the liver. So if liver is not happy, liver is not healthy, then person will not be happy. Person is having everything in the life, but even after that, he will feel no happiness because soul is not happy. If liver is disturbed, soul also disturbed. So if we want to make the etheric soul balanced, then we have to treat the liver. So nowadays, this is very common disease. The fatty liver, then it becomes cirrhosis of liver. One patient came for the treatment. So one patient came for the treatment. He was suffering with the cirrhosis of liver. 1 minute. Then slowly, cirrhosis of liver, plus he suffered with ascites. The meaning of ascites is, if this is the patient, now belly is bulging out and fluid is depositing in the belly because liver is leaking out. So fluid is depositing here. So this patient was taking out the fluid by the doctors once a week. Then he came to my clinic for the treatment of cirrhosis of liver. Is there any problem in connectivity? Now you can hear me. Can you hear me? Yes. Okay. So I was talking about the patient who was having very bad condition and suffering with the liver problem, developed the cirrhosis of liver with ascites. I used only 2 points of the master tool, just 2 points of master tool. The point number one was upper three yellow, upper three yellow. And point number two was wood inflammation. I used the upper three yellows, both the side. And I use wood inflammation only in the left side. And this is my personal experience. Just by using these 2 points, just within 5 to 6 days, I was giving daily same points because I felt this is a very complicated patient. I cannot do more experiment. So just I was putting the same point every day. On the 5th and 6th day, we have seen, because every 5 to 7 days, he has to go to the doctor to drain out the liquid, fluid. But this time, belly was reducing and no need to go to the doctor. So I got confidence. I was very satisfied. Oh, my point is working. Then I continue the treatment for 20 days. Same point. Within the 20 days, I gave 3 to 4 days break. So what is my suggestion? If anyone is suffering with any condition connected with the liver, either it is fatty liver, cirrhosis of liver, liver cancer, ascites, we can use these 2 points, which I'm going to tell you right now. 2 point unit. After treating this patient and after gaining the confidence, I tried these point combination to many patients suffering with a fatty liver, suffering with the cirrhosis of liver. Every time I've seen the success. So these points are one of the very good points given by the Master Tung. So let's see the first number point, which is upper three yellows. Master Tung has been given these points in the thighs. So all the points in the thighs are called 88 points, 88 point unit. So 88.01, 02, 03, 04, 05, 6, 7, 8, 9, 10. So if there is 88, it means points available in the thighs. So upper three yellows points are available in the thigh, and point number 12, 13, 14, these 3 point unit are working very nicely for this problem. So let's see. So we can see in this image, if you see this in image, this is the 88.12, 13, 14. If you compare with the traditional acupuncture, these points are available in the liver meridian. These points are available in the medial thigh, inside the thigh. If you are standing, touching both the thigh, so this part of the thigh touching each other. So this part of the thigh touching each other. So in this way, these points are very much effective point available in the thigh. Okay. So how to locate these points? So these are the 3 point unit. And how to locate these points? So for that, let's see one practical demo. Then I will tell you exactly how to locate this point. This is the knee. From the knee, if we go in the medial side, so on the lateral side, on the other side, on the outer side is gallbladder meridian, and inner side we can see the liver meridian. So these 3 point unit, 12, 13 and 14 are available in the medial side of the thigh. And all the points having 3 chun distance with each other, 3 chun distance. So what we are doing? First, we are locating the center point. How we are locating the center point? This point is 7 chun up from the knee. This point is 7 chun up from the knee joint. So we are locating this point 7 chun up from the knee joint, and we are inserting the needle here. One more thing to locate this point. If person is standing and hands of the person is hanging down, so where middle finger touch the thigh, that is the gallbladder 31. Okay, now you can see. I will tell you 2 ways to locate this point. Other way to locate this point. Let's see. Like, if some person is standing straight, so this is the person is standing straight, and this is the arm. So where, if we tell the person, okay, stand straight and touch your arm with the thigh. So where middle finger is touching on the outer side, on the lateral side. That is the location of gallbladder 31. And just opposite to that, that is our first point of liver. And from this, if we go 3 tune up and 3 tune down, so we will get all the 3 points. The center point is 12. So let's see once again our demonstration video. So look at in this image. I am going the 7 tune up from the medial part of the thigh. That is the location of 88.12 or 12 number point. 3 tune up and 3 tune down, we will locate 2 more points. So these 3 point unit together called upper 3 yellows. The outer point is gallbladder 31 on the lateral side of thigh, and this is 88.12. From this point, we are inserting 2 more needle, 3 tune down and 3 tune up. As per the master tune, if you miss the point, then also you will get the results. But do not miss the line, do not miss the channel. So this point is very effective for many more other problems. But right now we are thinking and working and talking about the liver. So look at once again, inserting the central point, that is 88.12. Then going 3 tune down and inserting the needle here, and 3 tune up, inserting the needle here. So these are the 3 point unit called upper 3 yellows. So in this way, we can see these points are very good for all the liver condition. And I have very good experience with this point. So we can do the treatment in 2 ways. Number 1, we can treat the right side one day and left side next day. In this way, we can do the alternate treatment. So on the day 1, we can insert all the 3 points on one side. On the day 2, we can insert all the 3 point other side. Even we can do bilateral needling, bilateral points. So these are the 3 points unit called upper 3 yellows. Upper 3 yellows having many more other indication, but one of the very great indication that it is good point for liver, any problem of the liver. We can insert the needle half tune to 1 tune. Kindly listen, sound from my side is full. Now, if sound is less, so kindly use the headphone. Because from my side, there is full sound. Okay. The needle we can use 1 tune or 1 inch needle. So we can insert the 1 inch or 1 tune needle. So these points are very good for liver blood deficiency, fatty liver, cirrhosis of liver, all the condition connected with the liver. So whenever any liver patient come to you, and the meaning of liver patient is, if someone is having blood vision, that is a liver patient. If someone is having more pressure in the eyes, that is called glaucoma, that is a liver patient. If someone is having numbers, myopia, hypermetropia, cannot see the near object, cannot see the far object. So treat these points, upper 3 yellows. And upper three yellows are very good for the chronic problem, for the old problem. If someone is suffering with some problem, with 6 months, 1 year, 5 years, 10 years, so these 3 points are very effective for the problem having since many years now. In my Ayurveda clinic, how I use these points, I tell my massage therapist, do the massage in this part. If I need that this patient need upper three yellows treatment. And if someone is having problem of the vision, problem of the liver, so this part is paining a lot. This is very sensitive and painful part. So doing the mild massage with the oil, and if you take some powder, if you don't want to take the oil, you can take some powder and just do the massage for 3 to 5 minutes here. Then also we can see the very good results. If we stimulate this area by any method, either with the acupressure or with the acupuncture or with the rubbing technique, so these points are very effective. Even we can do the treatment on these points without any needles. If we make our fist like that, if we make our fist and keep on the points, keep on the points, on the thighs, and do the pressure, like inhale, and with the exhalation, give the pressure, like see, suppose this is my 88.12. Inhale, exhale, hold, inhale, exhale. So in this way, wherever my liver point is, suppose I want to do the pressure here. So inhale, exhale. So we can stimulate the point even with the breathing technique and pressure. So these points will treat the problem of the liver, either be stimulated with the pressure or with the puncture. So let's proceed for the next point. The next point is called wound inflammation or 11.20. This is one of the very good point of the master tome. We can see here, it is written wound inflammation. It means the inflammation of the liver. Or we can consider this point as a wood fire. The meaning of wood fire, if someone is having bursting anger, during the anger, he is throwing the object here and there, an uncontrolled anger, uncontrolled aggression, or liver is having more fire, liver fire. When liver fire is more, then person will suffer with the high BP and with the headache and heaviness on the head, like expansion, something bursting out. So how to diagnose that this is the liver fire? The person having high fever because of the liver fire, how to diagnose it? The very good diagnostic technique. The person will be angry, aggressive in the nature, and having high BP and headache. Many times this thing may happen. If you become angry, then suddenly liver fire arise and person suffer with a high blood pressure. Okay, so whether the person having BP or not, whether the person having headache or not, whether the person having anger or not, if you see the report, in the report, if it is fatty liver, Then also we have to treat with the 11.20 point. So for my this patient of the liver cirrhosis, this was my second point. And I always inserted this point only in the left side, only one side. I never needled this point on the right side because master told the 11.20 point are more effective in the left hand. So let's see the location. So we can see this location in the ring finger. So look at the ring finger here. In the ring finger, this is the middle phalanges. In the middle phalanges, just on the border of bone, this line is called a D line. On the workshop 1, this is our fourth workshop. On the workshop 1, we have learned about the lines. So this is the D line, just on the side of phalangeal bone, on the border of bone, we are inserting 2 needles with equal distance on the middle phalanges. So let's see once again in the other image, so that you can put the needle with very accuracy. So after my demonstration, if you find that for you accuracy is not possible, then let me know. I will try to explain in other way. So look at the ring finger here. In the ring finger, this is the middle phalanges. And we know inside we are having phalangeal bone. If on the border of phalangeal bone, if we insert 2 needles on the small finger side. So as per the master term, this is D line on ring finger, on middle phalanges, on the border of bone. And how much insertion is required? Not 1 chun insertion is not required. Even half chun insertion, half centimeter insertion not required. We can do the insertion even half of half chun, means only 0.25 chun. Like 1 chun means 1 thumb width. So just 1/4 insertion is enough. Very little insertion of the needle is enough. So we have to put the 2 needles here. 1 needle here and 1 needle here on the left hand. These points, very good points. The name of these points is body inflammation. So just why these 11.20 point and upper 3 yellows, I have seen success in many patients. So whenever you see any patient having liver problem, you can definitely apply these 2-point unit. In the master Tung acupuncture, there are many points in the ring finger belong to the liver and gallbladder, liver as well as the gallbladder. As per the master Tung, ring finger is very good for liver. So in this way, I hope you have understood the location of these points. So now I can proceed further. So is it clear? Shall we proceed? The duration of treatment will be 40 minutes. In the master Tung, no tonification, no sedation, just needle, even method. Okay. No, 11.20 point we have to put only in the left hand. Only in the left hand, no right hand. In the master tongue acupuncture, if we put the needle both sides, many times needle is not working. But in the legs, we can put both the sides. But many points, if you feel, because in the one thigh, you can put one day, on the next day you can choose other thigh for upper three elbows. And every day you have to put 11.20 in the ring finger only in the left hand. No. For the gallbladder stone, we have another point in the master tongue. So let's proceed now for the next point. No directions, no tonification, no sedation, just even method. Just put the needle. If needle is directing toward the proximally or distally, don't worry. Our intention of even method. In the finger, we can put auricular needle in the fingers. But in the thighs, we have to put little bigger needle. These points are also very good for the irregular menstruation because liver is the storehouse of blood, supplying blood to the uterus. If liver is not good, if liver blood is deficient, then female will suffer with the scanty menstruation, lesser menstruation. So we can improve the health of the liver. Then we can treat the scanty period very nicely. With that, in the master tongue, there is a very good point called three sisters. The three sisters point especially has been given for the menstrual problem. Either this is the scanty menstruation or this is the excessive menstruation. The point are three sisters. They are the different point. Okay, even I am sewing in the right hand. No problem, but we have to put in the left hand. Because I took any hands randomly, but we have to put in the left hand only, in the ring finger, toward the small finger side. Next point. Sometime what happened? Person suffering with two problems. Number one, the problem of the liver. Maybe it is fatty liver. Maybe it is cirrhosis of liver. Maybe it is liver cancer. Maybe it is any liver problem. Or maybe liver is absolutely normal. Liver is having no any problem, but person is having lots of anger. If someone is having lots of anger, then also we categorize the person in the liver patient as a liver patient. अगर आपने केवल रिंग फिंगर का भी ट्रीटमेंट दे दिया तो भी चलेगा. If you give the treatment on the ring finger only, even this treatment is working because both the points are very effective, independent points, but we are combining them for the better results. And do not try to combine all the points together because we are going to put the point on the ring finger, and whatever other points we will learn, put that point also. So that is not good idea. Why? Because master tongue points are more effective. So sometimes if you are doing more effective treatment, too strong treatment, person is unable to digest and he will suffer with some problem. So better use only 6 to 8 points at a time. So 3 points we already inserted in the thigh. 2 points we already inserted in the ring finger. So 5 points done. For one treatment, this is enough. Now, in the second treatment, if you want to add something, then we will see some other point now. So now we are going to learn one other point. The name of this point is wealth apex or 44.04. These points are in the upper arm, this part. You know, our upper arm is very effective. When we want to fight with someone, we do like this. Because from here, we are igniting the energy. Liver is the great general. Liver is the great fighter. Liver is aggressive. If you want to fight with someone, if you want to go in the war, if you want to work as a great aggressive leader, then your liver should be active. So that's why when we want to fight with someone, we are activating our liver in this way. In this way. Now, look at this bone. And this is the small finger. So this is the bone. And this is the small finger. And this is the bone. Now this is another bone. The name of this bone is humerus bone. Humerus. Only one bone we are having here. So from this process, if we go 10 finger, 4, 4, and 2. Just on the border bone, this is the point of liver. This is the real point of liver. If you press this point, so keep your thumb here and keep your one hand on your forehead and do like this. This point is very good for liver as well as heart. This point is very good for liver as well as for a high blood pressure. We can raise this hand anywhere, like we can raise this hand here, or we can hang like that also. So this point is 10 finger proximal from the olecranon process, or 7 chun proximal from the olecranon process. So from this olecranon process, it becomes 7 chun proximal. So this is the liver point. Even what I'm telling, keep your hand on the chest like that. After keeping your hand on the chest, now from here, if you go 10 finger, 4, 4, and 2. So this is the point on the border of bone. So even you can keep a middle finger, one more finger, all the 3 finger, and you can do like this. Or as an acupuncturist, you can put the needle. You can put the needle here. If you put the 1 chun needle here, this needle, if you do just right down, if you do right now for 1 minute, you will feel very cooling effect in your liver. This point has been considered for the liver problem. This point we choose when someone is suffering with a high blood pressure as well as with the liver problem. So this point is very much useful, means only 1 point and 2 target. 1 point and 2 target. Okay, I am showing again, don't worry. Target number 1, liver. Either there's a fatty liver, cirrhosis of liver, any problem of the liver. And target number two, high blood pressure. If someone is telling you, oh, I am feeling something uneasy, feeling more pulse, feeling like some BP is high, and that time also, if you feel that, okay, let's do the treatment of high blood pressure as well as liver, you can choose this point. So look at once again how to look at this point. Keep your one hand on the chest. I'm turning. Keep your one hand on the chest. Now from this process, if we go 10 finger up on the backside of this bone, the backside of this humerus bone. So from here, forefinger, forefinger, and two finger. So this is the point on the border bone. Or we can tell 7 chin up, 7 chin up. So we can put the needle here. We can put the needle here. If we want to target the liver, like yesterday, one patient came to me. Oh, I am feeling some uneasiness. I am feeling that my pulse rate is high, or and this happened when my BP is high. Okay, then I just inserted 1 point here and 1 point, one more point, little up, to for avoiding, or maybe if I am not accurate, if maybe for covering the channels. So one needle and 1 point little up, like near about one chin up. So inserted the two needle. Because I was not having in my mind that I have to treat the liver. So that's why I put these 2 points on the right side, because right side will treat the heart. So these points, even we can put the bilateral. One day in my clinic, one patient came and he told, I'm having lots of chest congestion, chest pain. I put the needle both the side. Both the sides. So these points, even I'm putting both the sides. But if we target only liver, then the left side will work more efficiently. But if we want to target the liver as well as heart, then one day we can put on the left side, one day we can put on the right side. In that way, we can keep on changing the side. If you don't want to put the needle, if you just want to do the acupressure, you can squeeze the border bone. See, you can squeeze the border bone and just do like this. Even if you do like this, automatically pressure will go there. Or you can press with the fingers. You will see very good effect on the liver. So this point is called belt apex 44.04. We are having 2 more points here. But right now, because I want to focus on the liver, so this point is very good and very effective. Yes, this is the point. On the border of bone, outer side, the border of the bone, because this point, if we see, this point is located in the back side. Because if I am standing, keeping my thumb like that, if I am standing like that, then this point, if I am standing in the Savdhan Mudra, whatever Savdhan Mudra, like that, then this point is going on the back side. This point is not in the front side. This point is the back side of the border of the bone. These points are available in the triple Borman meridian. If you want to know in the meridian language, so this point is called belt apex. Very effective point for the violet color at. What is the meaning of this violet color at? I did not understand. See, as per the master tongue, either you want to treat the liver deficiency, liver blood stasis, liver stagnation, liver fire, same point will be there. This is the beauty of master tongue. If you treat the master tongue points, if you want to treat with the help of master tongue points, you categorize the disease in three patterns. One is, suppose it is very chronic disease, chronic, very old disease, 5 years, 10 years, or 1 year, 2 years, that is also chronic. Then go in the thigh and use upper 3 LOH. But if it is acute problem, very new problem, then come in the arm. Come in the arm. Why? Because acute means young, arm is young, and chronic old means yin, lower part is yin. In that way, if someone is telling you, doctor, I'm suffering with acute liver problem, if you see suddenly someone is getting the liver disorder, acute hepatitis, the patient is coming with the report acute hepatitis, and if you see someone is suffering with the liver problem which is very aggressive means young, then come to the arms and treat the liver with the help of arms. But if you see, oh, this is a very chronic problem and damaging the body very slowly, not aggressive, then go in the legs. We cannot needle immediately after the meal, because after having the meal, all the energy is going to spleen, and spleen is converting food in the food chi. But if you are doing the needling, then spleen is not getting the energy because you have directed the energy for the treatment. Then spleen is not getting the energy. Then spleen is not able to convert the food taken by you into food chi. Then it will be damaged. So don't do anything immediately after the meal, minimum for 1 hour. Let the patient relax or do something. Don't direct the needles. Don't direct the energy. That time all the energy we need in the abdomen for the digestion. Nowadays, many people are suffering with a spleen problem. Why? Because they are eating and working in the office, working on the computer, working on the mobile. Immediately after the meal. If you take the meal, after that, just close your eyes. And if you don't have any bed to lie down, just close your eyes and sit for minimum 15 minutes, 20 minutes, or 10 minutes at least. Let all the energy go in the stomach. But if you are having bed, then lie down for 20 minutes, not more than that. If you're sleeping for 2 hours, that will also damage. Then spleen will make lots of dampness, phlegm, kapha. And after 20 minutes, 30 minutes, you can start working if you've taken very good rest. And after 1 hour, you can do the treatment. So let's proceed for the next point. The very effective point, if someone is suffering with the acute problem of the liver, all of you already know this point. When you treat the liver will automatically store more blood, will supply automatically more blood to the uterus, means the blood whatever required, everything automatically will get balanced. So I was telling you next point. The name of next point is liver gate. Liver gate point is very famous point of the liver. And liver gate points are available in the lower arm. So if you see my arm, this is the lower arm. Now I am talking about this area. From the wrist crease. So look at me. This is the wrist crease. From wrist crease, if we go 3 chin proximal, this is intestine gate. So this is the bone. The name of this bone is ulnar bone, ulna bone. On the border of ulna bone, if from the wrist crease I go 3 chin proximal, this is the intestine gate. And again I go 3 chin. This is the liver gate. So liver gate having total 6 chin distance from the wrist crease. So from the wrist crease, if I go 3 chun plus 3 chun, this is the location of liver gate. If I keep my thumb here and press this point, so this is a very good stimulation technique of the liver problem. If I insert the needle only half chun, so this is the very good treatment of the liver. The question comes, we are having point here. And we are also having point in the thighs. So which one to choose? So answer is, this point is very effective for aggressive problem, for young problem, for acute hepatitis. And the points in the thighs are very good for the old problem, for the chronic problem. But if you are confused, oh, for me it's very difficult how to know this is the acute or this is the chronic. So for any liver problem, you can use any points. Either you can use this point or you can use this point. Even you can put both the points together. No problem. But the selection of number of points should not be too much. So I'm telling you once again, from the wrist crease to the elbow, this is total 12 chun. 12 chun. Now from the wrist crease, if I go 6 chun, means this liver point is just in between the arms. Just in between the arms. If you don't know how to measure, so just measure with the thread from here till the here and do the half. So that is the liver point. So that is the liver point. So when we insert the needle in the liver point, this point is very effective for all the problem. Like someone is suffering sudden redness of the eyes, suddenly redness of the eyes. So this is acute problem. Suddenly eye pain, suddenly tearing the eyes, suddenly pain in the liver, suddenly migraine headache on the top of the head, on the D20. So if someone is suffering with any problem, suddenly that is acute. So we can treat the problem of the eyes, the problem of the top of the head, pain, with the help of this liver gate point. Liver gate point or 33.11. Already we have seen this point in the yesterday workshop. Yesterday we have already discussed this point. We discussed all the three gates. Yesterday we discussed intestine gate, liver gate and heart gate. So this point, just in between the lower arm, on the border of ulnar bone, I told you that keep your palm on the chest and feel the border bone. So just in between the lower arm, this point is located. So this point we are using on the left side for the liver disorders. But if you want to treat the eyes, so person is suffering with the right eye problem, you can treat on the left side. Person is suffering with the left eye problem, you can treat on the right side because opposite side approach is more effective. There are many more points left, but we will discuss last point as per our time commitment. So we will discuss the last point now. Let's see, try to connect again. The timing of the needle should be 40 minutes. From the 21st November, we are starting our mastering workshop. And in the mastering workshop, we will work separately for the liver disorders, what to do, for the heart disease, what to do, for the reproductive problems, how to make the protocol and how to plan the treatment. So almost each and every disease we will cover. And we are going to organize one workshop from 21st November for 40 days in the evening time. So this workshop will be in very detail. So we will start from very, very basics. We will start from the zero and we will go to the basic as well as in the advanced aspect of the master tool. So if any one of you want to learn this system in detail, can enroll for this workshop. We are going to start from 21st November this month only 21 days left. Now, we are going to discuss, in the main workshop, we will take the class in English and in Hindi, one by one. First, we will finish the class in English. After completion of the English, we will take the class in Hindi. तो हमारा जो मेन वर्कशॉप होगा 21 नवंबर से, उसमें हम पहले इंग्लिश में क्लास लेंगे और पूरी क्लास इंग्लिश में खत्म करके फिर हम पूरी क्लास हिंदी में लेंगे. दोनों ही लैंग्वेज में हम लेने वाले हैं. अब हमारा अगला पॉइंट है और आज का लास्ट पॉइंट जो बहुत ही इफेक्टिव है, जिसे हम कहते हैं 11.17. If you see in this image, so look at the index finger. In the index finger, in the lower phalanges, you can see this point. So the 11.12 point, the 11.12 point or Wood point, also called Wood anger point, and located in the index finger in the lower phalanges. So let's see practically in my hands. You will understand very clearly. So this is the index finger. In the index finger, if we go on the D line, what is D line? The border of bone. The border of bone. The border of bone, that is D line. Because we have already learned this is the A line, then B line, then center is the C line, Then this border of bone is D line. So in the border of bone, if we, in the lower phalanges, we make 2 points at equal distance 1 and 2. So these 2 points called Bud point or Bud anger point. Bud point or Bud anger point. So we can insert the Sujog needle, very little insertion, one here and one here. Now as per the master tomb, this finger is the finger of large intestine because our large intestine meridian is passing from this finger. We know large intestine 1, large intestine 2, large intestine 3 and all. And large intestine belong to the Yang Ming family, having relationship with the Zhu Yin family. Maybe you are knowing this. If you don't know this, then you try to understand the Yang Ming family is having relationship with the Zhu Yin family. The Zhu Yin family means liver. And Yang Ming family means large intestine. I will explain this thing in the detail in the main workshop. Right now, just try to understand that large intestine having very deeper relationship with the liver. If you do something with the large intestine, it will affect the liver. And if you do something with the liver, it will affect the large intestine. That's why in the finger of large intestine, we are having liver point. So when we are inserting these 2 points, 11.17 or Bud point or Bud anger point, these points are affecting the liver, and these points also called common cold point. So 11.17 or Bud point or Bud anger point or common cold point, very good for running nose and common cold. Because liver meridian is going, liver meridian vein coming like that, coming from the genitals, supplying the genitals, coming up, crossing the throat, then making the circle around the mouth, then touching the nose and going in the eyes. So running nose and stuffed nose, and especially nose problem, sinusitis. So this point is very good point, 11.17. Then this meridian is going in the eyes. So this point has been considered very good point for either dry eyes or tearing of the eyes. Suppose someone is traveling and suddenly he got the wind invasion, attack of the wind. And because of the attack of the wind, now suffered with the tearing eyes. Or some other person getting the dryness in the eyes. So these two opposite problems can be treated with this 11.17 point. My one patient told me, I'm having too much anger. Can you do something? I told, okay, do one thing. On the border of bone, from here to here, complete, you do acupressure every day for 1 minute on the border of bone. So he told, after 1 week, I'm much better. I'm so impressed that a single pressure can handle my temperament. So the 11.17 point is very good for common cold, as well as very good for the dry eyes or tearing eyes. Many persons are putting the eye drops frequently because of dry eyes. Doctor is telling them, okay, put eye drop every 4 hours. And they are dependent on the eye drops. That is because of the liver heat. So we can put the needle here for 30 to 40 minutes. Even you can put the star magnet in all the master tongue point. Either you put the star magnet or you put the needle or you do the acupressure. Whatever method you apply, points will work. Point is going to work. So in this way, the 11.17 point is very good for common cold, sinus, dry eyes, tearing eyes. anger. That's why the name of this point is wood anger point. And sweating palm, sweating palm. Now it is lots of kids, lots of students, they are getting sweating palm. So these are the few indications of 11.17. So today we discussed upper three yellows in the thigh 3-point unit. That is very good for the chronic problem. Then we discussed 11.10 in the ring finger in the D line 2-point unit. Very good for the liver, that is called wood inflammation, liver fire. When there is a more, liver is more problematic. Then we discussed 10 finger up liver point, which is very good for the liver problem as well as high BP. Then we discussed just in between this lower arm 1 point, liver gate, that is very good for the acute problem of the liver. Then we discussed 11.17 wood anger point, very good for the eyes, nose and sweaty palm. So don't worry, I will share this video to all of you so that you can memorize all the points, because all the points are too effective. So thank you so much and good night.